Angiboni ukuthi isiza le ndaba yama-testing and screening because i-virus namanje abakayi-contain yena isaspreada, so angazi ukuthi izoyenza.
Ngiyaziyo nge-corona bhuti wami iyakhawata ngoba ngibona ama-numbers akhona ahlezi akhuphuka on TV worldwide yabo. Yeah, iyo into engayisho nge-corona ngoba it's too bad.
I-COVID ngibona ngathi sabantu izospreada because iJoburg is a very busy place nenumber isase-large vele.
Ngoba ama-number we-Gauteng ahlezi akhuphuka ngoba government is doing hard ukusitshela nge-corona ngoba thina abantu abamnyama bheka nje namanje ukugcwele, we are too ignorant.
Our numbers are really not going down. We're not looking good at all. So it's quite imperative that we take necessary precautions, including testing, screening, so that, you know, if there is any symptoms or anything like that, you are able to deal with that immediately.
At the moment, angazi like a lot. Angna knowledge about government ni or society like abasniki ngathi ama heads up nokuthi ingena kanjani or kanjani ngibona mina unnecessary.
I'm not comfortable from where I'm standing. I'm concerned. The only thing that we can do is to stay positive, stay in prayer, and very important that we, you know, keep and stick to the regulations, you know, things like social distancing, putting on our masks, and just making sure that we are protected in any possible way.
Yakhula lona kuphela ukuthi abantu abazinaki indlela abenza ngayo abafuna ukulandela imithetho nomqaliselo ukuthi umuntu nomuntu kumele ukuthi azivikele ngemask. Manje abantu basihambela nje abafuna kwezi zinto ezi-right.
You're watching Expressions, your favorite youth current affairs show. We're asking a very important question on today's show. We're asking whether we're educating people enough about COVID-19, but most importantly, is there clarity when it comes to testing? Now, we thought the best way to deal with this issue is to actually deal with it here at home. So we are currently on location at the SABC. As you can see in the background, it is the SABC Wellness Center. Now, we're going to be speaking to Sister Ulebo Marubela. Now, she's going to be giving us a lot of enlightenment about this issue around testing. For you, Gohayo, do you even know when to test? Do you know how long you should wait once you've tested? Now, these are the answers that she's going to be giving us as we discuss this very important issue. So come with us and hopefully you'll be enlightened. Sister Lebo, a very warm welcome to Expressions. Thank you so much for just taking the time to be able to chat to us about this very important issue. I think before I start, let me just do my due diligence. I think maybe just let's start right at the beginning. When should people test for COVID-19? Under what circumstances?
Firstly, you should test if you were in contact with a confirmed case. A confirmed case is someone who has tested for the COVID-19 and the results came out positive. And the person has listed you in the tracing list. There's something we call the tracing list, which must be completed by the infected person. The first step would not be testing. You'd first self-isolate, staying at home for a period of 14 days. During that 14 days, that's where you start monitoring any symptoms that can be related to the COVID-19. Could be the elevated temperature, fever, a dry cough, sore throat, loss of taste and smell. It gets severe to diarrhea and vomiting. Once you start getting symptoms, of which these symptoms can start exhibiting themselves from day 5 to day 7, then you can see your healthcare practitioner and be referred to do a test at any laboratory.
Please maybe clarify for us, when we're talking about confirmed cases, what exactly are we talking about?
A confirmed case is someone who has undergone a diagnostic testing, actually gone to the lab for the testing, and the results came back positive. That is a confirmed case.
So, Sister Lebo, maybe also clarify for us, what is the difference between someone who exhibits symptoms and someone who is asymptomatic?
Asymptomatic simply means, yes, you have been confirmed that you have a COVID-19 virus, but you are not experiencing or presenting with any symptoms, be it the cough, fever, the sore throat going on forward. As much as you have the virus, but you are asymptomatic, you are not exhibiting any, of which it happens with a lot of people as well.
So how do you then tell the difference between the common cold, I mean, considering the fact that we are in the winter season, and someone who exhibits symptoms that do look like the common cold, but they are COVID symptoms?
That's a very difficult one, because being it's winter, we're all prone to be infected with the, what we call your common cold. The difference would be, with your common cold, it would go away within 3 to 4 days. You wake up, you are fluish, you take your normal over-the-counter medication, and it would be away in a few days. But once it starts prolonging, the period of 7 days going on to the 8th day, 9th day, now that should raise an alarm to say maybe it could be. So it's not easy to draw the line, but once it exceeds a period of 7 days going on to your 8th, 9th, then it's advisable to consult your general practitioner, who can refer you for COVID testing, just to exclude the virus.
So, I mean, we've also heard as well that SABC employees not only are at risk, but some of them have also tested positive for COVID-19. We want to find out, as someone who actually is within the SABC, whether SABC employees are actually utilizing the infrastructure that has been created for them to not only educate them, but also make sure that they are tested.
Yes, they are being utilized. We do offer support. We do offer monitoring of our employees, and we provide PPE as well. And then we also offer counseling services, because it can be a psychological matter as well. What I can advise them to do, if you have flu symptoms, or you think you have a common flu or cannot tell the difference, the safest way is for you to self-isolate, stay away from work, from a lot of gatherings, until the symptoms have subsided.
So there's a lot of stigma when it comes to COVID-19. A lot of people are extremely fearful, and there are myths that are also going around. I mean, what is your advice around, everyday, public and society, to be able to, look past that and really be able to differentiate between facts, myths, and stigma around COVID-19?
I'd say it's perfectly normal to fear, because if you don't know something, you will fear it. But if you are taking all the necessary precautions, there's no need for you to fear. If you're wearing your mask, you are sanitizing, you are washing your hands, you are maintaining the social distancing, there's no reason to fear. All we need to do is just abide by the guidelines given to us and educate ourselves with the virus, instead of creating unknown myths or misconceptions of the virus. Instead, educate yourself.
As an essential worker who every day, and it's part of your job, to be in the front lines and be dealing with either employees at the SABC who might be positive with COVID-19, or people who've recovered, you're constantly exposed to this. How does this affect you and impact you? I mean, what risks do you put yourself in? And most importantly, then with your family, what do you expose them to?
It's a very difficult time. I think the best way for, as an essential worker, is to also abide by the regulations, by the guidelines, take extra precautions if necessary. If it is strenuous to always be thinking, I can't go home today to see my children, because this might happen. It affects me personally, emotionally as well. It's draining. Physically, it's draining. They affect me as well. So I need to protect myself by using the PPE being given by my employer, making sure that I protect my family by always sanitizing, also educating them as well, and seeking psychological help when necessary.
Sister Lebo, thank you very much for just having this chat with us. I think you've provided us with so much clarity, and I know that there are a lot of people out there who might be confused, but I think hopefully from this conversation, they have a better understanding of what they should do, what they should not do, when they should test, and when they should not test. So a big thank you for that. Okay, Mobogedi Kohoaya, I hope you have been enlightened on this very important issue, and I hope you have received the clarity that you require in order to know how to maneuver as we are facing this COVID-19 reality that we're facing in South Africa. You're watching Expressions. We'll be back right after this.
All we know is that the month of July is going to be a very difficult month. The people of our province must understand this message. Running up and down, just going to marches, because there have been a lot of marches organized, over some for good causes, especially the marches around gender-based violence and the killing of women have really been inspired by the outrage that is out there. But even with that, even with marches like that, we want to caution the people of our province. It is in those places where the people are going to contract COVID-19, but also with funerals. We have seen in some of the funerals, even there, when people are outraged by what may have happened, there must still be compliance. People go to funerals and they don't quite comply.
Welcome back. You are still watching Expressions. Today we are speaking about whether we are doing enough to educate people about COVID-19, but most importantly, is there enough clarity that is established when it comes to testing? Now we want to speak to an actual SABC employee to really find out what his experience was, especially when it comes to testing. Talk to us, Uti. What happened to you when you were first exposed to COVID? What was going on?
No, we were in the production in Studio 2. So Sister Lab actually came from Wellness Center, and they told us that someone was exposed to COVID-19. So they gave us some forms so that we can go and test and go to the lab. Going to that lab, it's frightening because you don't know, especially when you get closer to the testing center, and it's scary. I remember one of my colleagues actually said to me, "Come down, you'll be okay." So I went in, she put some long thing on my throat, tested me, then I left. It was painful for the whole day. After that, they said we need to isolate ourselves. So I isolated myself, got a call from Sister Lebu, but the results, the initial one, the first results when I received were negative, and then I got the positive results. I'm going to take the positiveness of this and do something about it, because this thing doesn't have, it's COVID-19. Who is it? I bought my vitamin C's, I bought, umhlonyane as well. I have my garlic and ginger and water. All of that, trying to make sure that I boost my immune system, because that's what I had, that it boosts the immune system, and it shouldn't be, as well cold. You need to dress up as well, make sure that you're not cold.
So then now, explain to us, how do you test positive and negative at the same time? Did the results come at different times, or did you go test at different times, and that's why the results came different?
I tested at different times. I had the first one. The second one was at close to work. The first one was in a clinic close by here. So the thing is, it confuses you as a person as well, that why is that? So I started doing research, which is one thing that I do the most. Went to do some research, check how many people have had inconclusive results, quite a number of people. And I wanted to be retested. They said, no, that doesn't happen. Just isolate yourself, you'll be okay.
What were your fears? What was going through your mind?
It is scary, because you don't know. People need to understand it's there. There is something called COVID-19, and it's for real, and it kills.
So we've just had our conversation, no Budluyanda. Now I'm standing next to Usis Sanele, and she also obviously had been exposed to COVID-19 now, but she had a very different experience, of course, from Budluyanda, and this is the story that she wants to share with us.
For myself, much like a lot of other people, I thought that COVID was far in the horizon, and I didn't think that it would come any closer. But as soon as we got the news that some of my family members had tested positive, and I was around them for long periods of time, I had to go and get tested myself. I wasn't feeling any symptoms until they had tested positive, and I had phantom symptoms like my chest was tight and those kinds of things. And then when I got the test, it was just a matter of waiting. I thought I'd wait for a week or so because of the backlog, but it took about 3 to 4 days because I tested on a Friday and I got my results on a Thursday. And they didn't detect COVID, so that was a huge sigh of relief for myself.
How was that experience for you?
Yeah, so I did the swab test through the nose, and it was a very uncomfortable experience, I must say. I thought it was going to be as simple as just through the nasal canal and out, but there's a part where they put the swab through the nose and they go even deeper through the canal, and that was very, very uncomfortable, very unexpected. They do tell you to expect a bit of uncomfortability before the test, but I never anticipated for it to be that uncomfortable.
There's a lot of stigma around this. I mean, what's your take on it, especially when you had to kind of go through it and you had to wait to find out your results?
It makes you feel, for the most part, I think a lot of people don't want to disclose their status, especially if they've tested positive. And once you've tested for it, you get you become really afraid to leave home because you think that probably if you have it, no matter however it's transmitted, that whether it's on someone's clothes or whatever, you become very frightened to leave the house, and especially if you're a person who doesn't like to see people suffer or anything, you don't want to give it to anybody else. So waiting for my tests results was a bit of a harsh waiting game. It wasn't easy at all, and especially not having contact with my partner or my son, and just making sure that I was isolating in the bedroom.
There's going to be, well, there currently is actually a huge spike in terms of COVID positive numbers and cases in Johannesburg and Gauteng as a whole. I mean, how are you feeling, having gone through this whole entire ordeal? I mean, are you now more paranoid, or now that you've gone through this, you just feel better equipped to sort of handle whatever we might be facing?
I think information is key in this era. I think if you keep informed and keep in touch with the Minister of Health and his department's announcements about the numbers and where you're likely to be affected, and just also following the regulations is not that hard. It's the simplest. The President did say it's the simplest of actions that will keep us from this tremendous ordeal and this horrible pandemic. Just by washing your hands and staying home, it's not that hard. Wearing a mask when you go out, I think just keeping well equipped and informed throughout the whole time. And I think because it's winter and we're experiencing our colder months right now, we're expected to see a higher infection rate. But if we can just keep to ourselves, and also when you live in a place with a lot of people, because that's what happened to my family, is that there's a lot of us in the house. And we didn't anticipate that anyone would get it in the house, and that's how the spread sort of started. So I think it's just a matter of keeping informed, keeping clean, keeping safe, and adhering to the regulations.
And thank you so much for watching. We're going to an ad break. Don't go away. Stay with Mzansi for sure on Expression.
Right now in this particular segment, we want to focus on funeral parlors. We want to find out how COVID-19 obviously has affected them, and obviously the issues surrounding COVID-19 and people obviously who end up being at the demise of this disease. I'm on location in Soweto. Let's find out what she has to say about this issue. Come with me. Mam Patricia, hello.
Hello.
Unjani?
Unjani.
Welcome to Expressions.
Thank you.
Mama, maybe talk to us a little bit about the funeral parlor that you run here, Style and Grace Services.
Kunzima okwamanje ngoba nathi asikho we're not safe. Especially masiyolanda ibody yomuntu. Let's say ushonile endlini. Fanele sithole lama PPEs and sanitize nestumbu. And ukukhost konke lo esikwenzayo. Number 2, masobuya futhi leyo PPE kumele uyilahle. futhi uphinde ufake enye futhi masesiyongcwaba. We are using ama-PPEs amaningi.
And masikhuluma nge-COVID, obviously, business ihamba kanjani? Are you seeing a lot of cases of people, especially kule community, who have actually passed on from COVID?
Yeah, abantu bayashona kakhulu. Ikhona i-COVID, it's real. COVID is there, iyabulala. I've got a friend of mine, umntana wakhona una 32 years. Usanda kushona khona manje ngiyamngcwaba naye Saturday. Ugule on a Saturday. Wayesibhedlela. On Tuesday, he passed on. So it's so sad, ngayo lo COVID.
Are you scared? Are you worried about your own personal safety?
I'm worried about my personal safety. Nami one. And that is why sizama ukuthi sisebenzisa ama-PPEs at all times. Distance, sanitizing, mask.
We've seen rapid number of burials. And you know, you can never say that it's good business because that is somebody else's loss. But regarding this, the business has boomed. We had an incident yesterday at Jablani Hospital where the BR66, it's written that it's declared that the patient, that the deceased rather, died of COVID-19. But the family was at loggerheads with the management of the hospital, saying that their mom died due to cardiac failure because their mom had a history of bronchitis. So we find that we're just going into a war zone and not knowing who the enemy is. The enemy is so camouflaged that you don't know what is what. So any hospital where there's a pickup, we go there dressed in our PPEs just to avoid COVID. Part of our service is to remove death from you guys, the thinking, and just to comfort the family. So whereas this thing COVID, it's really creating problems because now we find that now we're the ones who have to advocate for the government what's really going on.
Talk to us a little bit about just making sure your employees themselves don't expose themselves to COVID.
Right now we are really relying on the PPEs and the fumigation. That is our only hope, that is our only tool, that is our only shield and weapon.
And you personally, I mean, as much as you are running a funeral service, you also personally also have a family. I mean, how is this affecting you?
I like that question because when I go visit my mom, she doesn't even allow me to go inside her yard. She says that I do not have a fumigating machine, so I would rather speak to you over the phone because you could be carrying this thing. Because like I said, everybody's in the dark. So nobody really knows where this thing is. Nobody has definite answers that they will stand at court and say that, listen, 100% sure of what I'm talking about. So hence I'm saying that I just refer to my mom, that I don't even go inside her yard because of her safety. And I feel that I also have to protect it. But I'm here to provide a service to my clients, and I'm not gonna say whenever that they call that they say that somebody died and they say, hey, is it COVID, is it not? So I just have to go there prepared.
We hope from today's show that you're able to at least know what needs to be done when it comes to this issue around COVID-19 as well as testing. We've tried as much as we possibly can, of course, to cover all of our bases, but hopefully this will give you enough information and empowerment to be able to make a better decision when it comes to how you're going to be facing this deadly pandemic. From us as Expressions and me, Jacqueline Mapala, we say adios, muchachos. We will see you next week. Bye-bye.